Hey there, everyone. So excited for today's Reinhartz Rundown. We are talking about eosinophil blood levels in COPD management. Last week, we discussed the usefulness of various labs like procalcitonin and CRP levels. So we'll make sure to put the link to those videos below. If you haven't had a chance to take a look, go ahead and do so. All right, getting into the blood eosinophil count. This tool is very useful in making therapeutic decisions for the management of COPD. First, we do know that eosinophil counts generally tend to be higher in COPD patients, and that this correlates also to higher eosinophil counts and inflammatory marker levels in the lungs for these patients. The decision-making really comes down to the count itself. If the blood eosinophil count is less than 100 cells per microliter, this patient has fewer inflammatory markers in the airways, and the evidence shows they are less likely to benefit from therapy with an inhaled corticosteroid or an ICS. If the count is greater than 300 cells per microliter, this patient has higher inflammatory levels in the airways, and evidence shows they are more likely to benefit from therapy with an inhaled corticosteroid. These numbers, keep in mind, are just general thresholds. They're not absolute cutoff points. And of course, a patient is likely to fall between 100 and 300 cells per microliter. In those scenarios, the benefit is kind of incrementally increasing. So the higher the count, the more likely the benefit that the patient will receive. As always in COPD, the strongest evidence of benefit is with bronchodilators. So we are adding the ICS to at least one bronchodilator and often two bronchodilators, and we are not doing ICS monotherapy in COPD patients. That's the Reinhartz Rundown on blood eosinophil count in COPD management. We'll see you for our next video.